Ziyu Bao from the State Key Laboratory of Cognitive Neuroscience and Learning and IDG McGovern Institute of Brain Research on longitudinal behavioral and brain morphological changes before and after hemispherotomy.
Okay. Hello, everyone. My name is Ziyu Bao, and I'm studying at Beijing Normal University. Today, I will share my research on longitudinal behavioral and brain morphological changes before and after hemispherotomy. And we all know that after damage, the brain will plastic changes, and the studies on stroke have shown that the structure change and functional transfer will happen following local brain damage. So we want to know when the global hemisphere is damaged, what will happen in the brain. And the hemispherotomy makes our research possible. It is a surgery for treating refractory epilepsy and is connected and disables the cerebral hemisphere. And the studies have shown that the function transfer to the contralateral cerebral will happen both before and after hemispherotomy. So it is necessary to analyze with longitudinal data before and after hemispherotomy. And due to the difference of the lesion areas, there are left and right hemispherotomy. And we know that the brain has structural asymmetry and functional lateralization. So we want to know whether this process will be affected by the surgical side. And this is an interesting question. So to sum up, we focus on two questions. What are the longitudinal brain morphological and behavioral changes, and whether this process affected by the surgical side? And we did 3 studies, identified the GNV changes, relating the GNV change to behavioral improvement, and the predicting post-surgery behavior with the pre-surgery GNV. And our subjects are from the Pediatric Epilepsy Center of the Peking University First Hospital. After screening, 29 patients with left and 28 with right hemispherotomy were included. And each subject has a structure MRI, and their behavior were included with the Griffith Children Development Score. And the range of the surgery is 0.7 to 11 years old. Let's go. As shown here, the demographic and clinical information such as sex, the age of the surgery, and epilepsy onset of the 2 groups are well matched. So specifically, we use the OHBM to get the UGNV, and in order to control the development effect, we transfer the UGNV to the age-adjusted, and due to the lack of the control group, we use the normative modeling to get the score of the UGNV, and the details are shown here. So for the first studies, we use the linear max effects models to identify the GNV change before and after hemispherotomy. And as shown here, in the left group, we get 4 clusters with significant GNV change, and in the right group, we got 3. And let's have a look one by one. So you can see that the largest cluster was located in the contralateral cerebral, and the age-adjusted GNV increased in 2 groups. And to compare rate of the GNV development in patients and healthy people, we analyzed the UGNV, and it also increased. And the second largest cluster was located in the ipsilateral cerebellum, and the GNV shows the same pattern. So there was a greater GM growth or development than healthy people. And differently, there was a cluster in the contralateral cerebellum, and the age-adjusted GMV decreased in these two groups, and the raw GMV decreased in left group and had no significant change in the right one. So finally, there was only in the left groups there was a cluster in the contralateral cingulate gyrus, and the age-adjusted GMV decreased, and there was no significant change in the real GMV. And so there was a lack or delay of normal GM growth or development, or even GM shrinkage in these two clusters. So to sum up, for the first question, we found three common clusters: the contralateral cerebellum, and the ipsilateral and contralateral cerebellum with a different pattern. And there was a unique cluster only in the left group, and the unique cluster also shows that there was the surgical side effect. And for the second studies, we explored the relationship between GMV and behavioral changes, and we can see that only in the red groups, the GMV decrease in the contralateral cerebellum was related with the behavioral improvement, and this is interesting. The results show the relationship and the surgical side effect. And importantly, there are two explanations to this relationship: the active plastic change or the positive neurodegenerative atrophy. And we found that there was a study removed the contralateral cerebellum in rats before the hemispherotomy, and they found that the rats had the limited function recovery, and so we tend to think this active plastic change. Okay, for the last study, we predicted the post-surgery behavior by pre-surgery GMV, and we found that in two groups, the predicted value are related with the active value significantly, and we used three different algorithms. They had the similar results. Okay, and then we further compared the model difference with the prediction errors, and we found that the left one was superior to the right one. And here was the GMV feature weight maps. We found that the prediction feature weight maps are similar between the two groups, and the feature important methods are quite different. And these results showed the post-surgery behavior can be predicted by pre-surgery GMV, and the surgical set affected this process. So let's go to the conclusion. For the question 1, we found that the hemispherotomy will cause intense GMV changes, and the cerebellum may be a key role in the recovery, and the pre-surgery GMV feature can be used to predict the post-surgery behaviors. And for the question 2, we found that the surgical side effect in all the studies. So our study can help us understanding the plasticity changes of the brain or valuing the surgical side effects in the clinic. Thanks for all the main authors and co-authors and the technical assistance from the Qianzhong. And this work is supported by the National Natural Science Foundation of China. So this brings us to the end. Thanks for your attention.
Thank you very much. Perhaps only one question?
Yes.
Thank you. That was a great talk. for the behavioral change, can you tell us what the behavior was? How did you test it?
Oh, okay, sorry. I don't show that in my in here, and we evaluate the behavior use the Griffith Children Development Score, and it has 5 diamonds, and we use the factor analysis to get Weinman factors to as the overall behavior scores. Thank you. That's all.
So please join me in thanking the speaker.